Welcome back. Well, you would have seen the problems in Motherwell in the Eastern Cape over the last week, where people have not been able to get their chronic medication simply because there haven't been enough staff working at the government clinic there. It's the same kind of problem many people have faced quite often around the country. And as you know, there's a huge argument in our society at the moment about whether a national health insurance system should, in fact, be implemented. Dr. Juandré Klopper is a doctor who works with the group Sponsor Medic. Dr. Klopper, good morning. Thank you for your time. When you see stories like this, where people who need chronic medication have been receiving it for many years, now suddenly can't get it, what do you think is going wrong in our health system? Why does this kind of thing keep happening?
Good morning, and good morning to all the viewers. Yes. It is it's a complicated question, but there are a few answers that we can address today. Just recently, Honourable Minister Aaron Motsoaledi was asked how we as a country compare to the World Health Organization's recommendation that a nation has one doctor per every 1,000 patients. And his response, and this is a direct quote, he said, "We don't even look at it because we know we are very, very far from reaching it." And that is very unfortunate. So that recommendation that they referenced is that every country should have one doctor per 1,000 people. South Africa, we have 0.8, but that is when we look at the health system in its entirety. And, we know that we live in a two-tiered health system. 16% of our population enjoys the benefits of approximately half the expenditure on healthcare. That's our private sector. And then 84% are dependent on public health services. So we can look at our health systems as two separate countries almost within South Africa. And that's exactly what the Institute for Economic Justice and Section 27 did a while back. And they found that if you take the public health sector, we have about 0.4 doctors per 1,000 people. Now that is less than a third of the global average and less than half of the World Health Organization's recommendation. And on the other side of the coin, if we look at the private sector, we have 2 doctors per every 1,000 people. So that is almost double the recommendation. Well, that is double the recommendation. So it's 2 very, very different healthcare systems, and they're driven by very different mechanisms. We have, the private sector is driven by market forces. I put a lot of money every month aside for private healthcare, and that is my right. I pay for that. And then we have a very large section of our population that does not have that privilege that I have. And they are depending on, the tax revenues that are going into the public health system and that is administered correctly.
Okay, so we've seen this, there's been commentary like this for some time. There are a lot of things that are going on around it. So we obviously need more doctors. As I understand it, in fact, only public institutions, so public universities, are able to, funded by the government, are actually able to train doctors. Do we need to train more doctors than we do at the moment? And I'm also aware, of course, that there are doctors that are unemployed right now.
Yes, so we have a massive problem of unemployed doctors, and the solution is not to just train more doctors. And when we have a discussion about this, there is a very big elephant in the room that has to be addressed first, and that is our past as a country, and that is apartheid. So credit where credit is due. The task that was handed to the democratically elected government in 1994 is enormous. It is a very large task to try and build an equitable and fair healthcare system from the remains of what was a very unequal society and a very unequal health system. And amazing strides have been made. We've seen significant changes in our infant mortality and our life expectancy. And, for all the criticism out there against the Department of Health over the past 30 years, it has to be admitted that they have a very tough job, and it's not easy. It's not smooth sailing. And the problem is that doesn't mean we can turn a blind eye to the issues. We have a lot of unemployed doctors, and Honourable Minister Motsoaledi himself acknowledged that mismanagement and corruption within the public health system is a significant problem. Again, that's a quote from him. And then in the private sector, the Board of Healthcare Funders also released a report not long ago that showed that 30 billion rand was lost to fraud, waste and abuse in the private sector in 2023. And the problem is we often look at corruption and say that is the scapegoat of all problems. But in reality, we sit in the problem is much larger than that. In healthcare, our budget is shrinking in the public health system, but it's not because the Minister of Finance has it in for us. It's because our slice of the pie is shrinking because the entire pie is shrinking. We've seen over a decade of weak economic growth. We see a widening budget deficit, growing debt, and the tax revenues increasingly under pressure. And the problem started in 2016 already. The South African Medical Association raised the alarm that we cannot afford to employ all the doctors we're training. And that was 2016 already. Now, that was when the storm started brewing. But last year, we saw that we had 800 unemployed doctors. And as of this week, the South African Medical Association and Dr. Juandré Klopper from Judasa said that we have 1,800 unemployed doctors in the country at the moment. So the problem is that we cannot afford to hire all the doctors in the public health system that we are training. And more has to be done. Otherwise, we are going to see more and more instances like what we're seeing here at Motherwell. It is a tip of the iceberg. And I know Motherwell, there's a lot of other factors that come into play. There's been a lot of, criminal activity. There's been, nurses leaving the clinics themselves. And I do not envy the job of the Minister of Health and the Department of Health in Eastern Cape. I think they have a very hard job. But the reality is, these type of issues are going to become more commonplace until we step up our actions to prevent it.
Obviously there's a lot that needs to be done. Healthcare systems are massive. In our country, it's massive. They go through a large number of resources, bandages, needles, all sorts of things. So you can see the potential there for some kind of corruption. But there are other countries that also have big healthcare systems to manage. Do we need to do it in a different way? Do we need to stop having it going through the provinces, for example? And I know some people think the NHI will solve all of the problems, and some people think it's the worst idea ever.
Yes. So, as I mentioned in the beginning, it becomes a complex issue quite quickly. When to address that, let me start by saying this. You're asking me if we should do things differently than other countries. Let me say this. So Honourable Motsoaledi, you recently also stated that, we spend 8.5% of our GDP on healthcare. And that is more than the WHO's recommendation of 5% of GDP. And it's very close to European countries that spend 9% of GDP. So when he said this, his argument was going to the direction that there's enough money in the system, it's just not being distributed correctly. Now, the figure is accurate. The problem with that figure is it doesn't account for the size of our GDP. It looks at how much we spend of our GDP. So South Africa's GDP per capita is 48% of the global average. So what we're doing here is we are comparing apples with much larger oranges. And that's a completely different thing to do. So what needs to happen in the long term? Unfortunately, it's going to be economic growth that's going to be the cure for this problem. And the person who fixes that, who gets us out of the slump, is going to get 100 Nobel Prizes, and he's going to deserve each and every one of them, because that is the ultimate cure. But we cannot sit around and wait for that to happen. We as doctors are advocates for our patients, and we have to step up, and we have to take action when we see action needs to be taken. And last year, a panel of 7 experts from the South African Academy of Science convened, and they set out an 8-point plan of, realistic things that has to happen in our healthcare system. When we look at, where we are in the world stage, we cannot just go around copying other countries because we are very unique. So the first thing they said that has to be looked at is we need to set clear mandates at all the levels of the health system. And that means we need to set goals for people, not just activities. You don't just show up to work and get a list of activities. We have to incentivize people achieving goals, and that is very important. Second of all, this is self-explanatory, but it has to be said, we need to insulate governance and legislation from vested interests. Transparency and accountability are the 2 points that are driven hard in this conversation. We need to delegate authority more effectively. A good friend of mine, Dr. Puni Mamdu, is a public health specialist, and she always talks about the lack of mid-management capacity in our public health system, and those are things that should be addressed. And to that point, that goes to the 4th point that they raised, is the fact that we need more competent managers in charge. We need to prioritize merit-based appointments over political appointments. And again, easier said than done. It's a tough job to take that up. And then the last few points, the fifth point, we need to improve our systems, that the systems work more effectively. We see that in the management side of healthcare, the public health system, we have a lot of red tape. We have a lot of people complaining about, bulky and inefficient procurement systems and all these things that are taking up the time of management so they don't get to the important part of their job. And those, again, easier said than done, but we have to start working on these issues sooner rather than later. Then one of the things they highlighted, which is very important, and I am a massive advocate for this, and that's also why we started Sponsor Medic, is we need to foster public, private, and academic partnerships. There's a wealth of resources, and when I talk about resources, I'm not talking just about money, I'm talking about knowledge, experience. There's a lot of that in the private sector and in the academic institutions that can be leveraged. But there has to be a willingness from the Department of Health to do that, and there has to be trust in that relationship. On that note, the seventh point they raised was we need more community involvement.
Sure.
And I mean, engaging with local communities. I saw Newzroom was very involved at Motherwell. We see the community speaking out. I mean, just the other day, I saw Newzroom Afrika talking to community members. But we shouldn't wait for a crisis for these things to happen. Sure. This should be happening more often. And the last point is, whistleblowers need to be protected. The only way we can really make these systems more accountable is to really protect the people that's trying